Hello class, it's me Randall Boley again. I am giving my informative speech on chronic myeloid leukemia. This speech is to inform you of what chronic myeloid leukemia is. I want you to remember what the symptoms are so that if you have any of these symptoms, you should get a checkup from your family doctor as soon as possible. You see, last year I was diagnosed with this cancer, and I would like to explain to you exactly what it is so you may have a better understanding of what I live through on a daily basis. The symptoms of CML is pale skin, bleeding easily, fever, frequent infections, fatigue, pain or fullness on the left side below the ribs, loss of appetite, loss of weight without dieting. I went to go see my doctor because I was having night sweats, but I wasn't really thinking anything about it because at the time we didn't have an air conditioner and it was summertime. But at night I would just, in the middle of the night I would wake up just sweating profusely, and so I wanted to get checked up. And when I went in, he did some blood tests and he called me the next day saying that I need to get to the emergency room as soon as possible because my white blood cell count was 158,000, and the average normal white person white blood cell count is between 5,000 to 8,000. The steps to diagnosis are blood tests and bone marrow samples. What the blood tests are is they taste the white blood cells looking through a microscope, and on the bone marrow samples they take sample of the marrow from the hip bone to observe it through looking at it through a microscope to find out any deficiencies. The treatment options are targeted therapy with tyrosine inhibitor, high-dose chemotherapy with a donor cell transplant, biological therapy, splenectomy, and chemotherapy pills. They had put me on chemotherapy pills, which is called Gleevec. Now, it doesn't take away the leukemia. It basically just makes it to where the white blood cell counts are stay in the normal range. And I have to take these pills for the rest of my life. The prognosis of CML are all ages, but commonly in middle ages and elderly. The type of leukemia that I have is chronic myeloid leukemia. The stage is the chronic stage. The changes of the spleen. The spleen is likely to be enlarged. When I was first diagnosed with this, my spleen was pushing actually on my stomach muscles to where I would take maybe 2 or 3 bites of food and I would feel full. The changes of the liver are rearrangement of some liver cords. The chances of anyone getting this are 1 to 2 out of 100,000 people, with a majority of people that actually get it are men, which kind of makes me want to play the lottery because, you know, I'm 1 to 2 out of 100,000. Anyway, CML has changed me in so many ways. I no longer take anything for granted, being that I had not found out what I had when I did. With my white blood cell count being so high, I could have easily died. Thank you.